working to improve services for those with developmental disabilities. I'm Jill Horner. This is Comcast Newsmakers. With me this hour is New Jersey State Assemblyman Upendra Chivukula of the 17th Legislative District. Thanks for being with us.
Thank you, Jill.
Let's talk a little bit about the idea of maintaining a database. Having the information available by the state, a database maintained by the state for those with developmental disabilities. Why have a database in place?
Well, first of all, when you want to manage any program, you need to make sure that you have the right type of data in terms of reaching out to the people who need those services, as well as what services are being provided, and also the costs associated with that program. Because there's constantly in the budget, when you're discussing the budget, you're looking for programs to cut or resize, and when you have the data, you can make proper decisions based on data.
So let's talk about the idea behind a database for this type of program. Are there similar programs that already maintain a system where there's information currently in place, where they know exactly who they're serving already, that there's already a database in place?
It's not. I mean, it is all scattered. The data is there, and it is scattered all over the place. And when you try to consolidate the data so that way for management of this program, it is staff have to put together, you have to go through different databases and consolidate, basically creating a data warehouse of the information about the people needing this type of services.
So how would this actually work? How would you establish this system, a database? How would you maintain it? What type of information would be a part of it?
Well, I think first of all, what you need to do is you need to consolidate all the information that is available from various sources and try to remove some of the duplicate information and trying to make sure that you have accurate information, because this information has to be updated also. And how this information will be used is in that if you want to do outreach, if you have a special programs and people with disabilities and where they're located, and you can get the information to them, and also costs associated with the programs, and that type of information is very useful when you're discussing how, for the Department of Human Services, this particular division, how much money they needed and how many people are working on this thing, and how can we get the efficiency, and that's why you need this database.
So a person's gender, race, ethnicity, information as needed would be available on this database. Disability, different diagnoses would be available as well. Could this potentially help to streamline services or even improve services?
Yeah, definitely. When you look at it, there's a national movement from Washington, D.C. Trying to promote electronic health records, electronic information, so that way we can remove the redundancies and duplication, and having this type of information at the state level. And there are many providers of the services for this type of disabled people. And so what you do is that by having this information, you can really streamline that. Also, we can have an annual report and what has happened in the last year, and also constantly try to update this as we go forward.
Are there any concerns related to privacy by having all of these different individuals' information in one location? Well,
there is always that concern. I think that's the responsibility. We do have to comply with the HIPAA, which is a national standard, and there are requirements for that. And this is not to be available as a need basis, but not so much it's displayed in publicly, people can access that. This is basically trying to get the department to get all the information there, so that way they can plan their services.
And we just have a short time left, but what about the costs associated with creating and maintaining this database?
Well, if we have been doing it right, we should not cost anything, because we should have computers talking to each other and try to get the information, because we have this proprietary systems that the information is scattered around the place, and somebody has to physically go in and do that. It's going to cost money.
All right, thank you very much. We've been talking with New Jersey State Assemblyman Upendra Chivukula. I'm Jill Horner.